To the Society of Vascular Interventional Neurology and the MT 2020 committee, thank you so much for inviting me on the World Stroke Day. My name is Dr. Syed Fazal Zaidi. I'm a professor of neurology at the University of Toledo, and also the program director for the Neurointerventional Fellowship. But I'm also actually a professor, a visiting professor at the National Institute of Cardiovascular Diseases in Karachi, Pakistan, and co-founder of the Karachi Stroke Initiative, and I'll be sharing my experience in establishing a stroke program in Pakistan. So to begin with, Karachi, it's a large city. It's the 12th largest city in the world, population a little over 20 million based on the census from 2023. It's again, a large, ginormous city. A lot of strokes there, unfortunately. According to the WHO data, the incidence of a stroke is about 250 new stroke cases per year there. So that amounts to 50,000 new cases annually. Until recently, and again, I mean, the stroke thrombectomy trials showed that thrombectomy is very efficacious based on the studies from landmark studies from 2015. But until very recently, and I'm talking about early to 2022, there was no center which was performing stroke thrombectomies in Karachi. And again, it's the largest city in Pakistan. So the population was clearly very underserved. My journey began with a random phone call by interventional radiologist at the NICVD hospital, Dr. Irfan Lutfi. You'll be hearing from him shortly. He's an interventional radiologist who works in conjunction with the cardiologist at the NICVD hospital. And it's a large, busy center. They perform over 20,000 PCIs any given year, one of the largest and the busiest in Asia, actually. And the discussion was on the phone call, which I distinctly remember, is that currently there is no center performing mechanical thrombectomy in Karachi, and it's sorely needed treatment. And there are very few interventional radiologists or neurologists who would be willing or available to do this procedure 24/7. So his proposal was, until the time we get to the point where we can start training radiologists and neurologists and neurosurgeons in endovascular treatments, how about we start a program at the NICVD where the cardiologists who already have catheter training can be trained to do mechanical thrombectomy, and essentially to be able to provide at least some semblance of care to the citizen of Karachi. So after this phone call, we made up a plan to visit Karachi. He did request, bring as many supplies as you can, which I did. We received a lot of donation from our industry partners, which we took to Karachi, and then between myself and my colleagues from US. Over the course of next 2 years, we conducted numerous hands-on training sessions, lectures, conferences, stroke thrombectomy workshops. And then as we were doing these workshops, we were doing live cases to train the fellows and the fellows who are training in radiology and interventional neurology there. In the process, we performed over 50 life-saving treatments on patients who required complex treatments for their brain aneurysms. But as you were doing this, it became quickly clear that we needed a more organized effort, and that's where the Karachi Stroke Initiative emerged, and this was in late or fall of 2022. We came up with two goals. The overarching goal is to equip and train the local physicians so that they have the resources and they have the training to be able to treat the stroke and aneurysm patients in Pakistan, and then simultaneously be able to contribute in a useful manner to the neurointerventional field where there are so many innovations happening any given time. So with regards to our first goal, we work very closely with our colleagues in Pakistan. In fact, few of our colleague physicians from Pakistan visited me and worked in my lab. So this picture is Dr. Kamran Khan, who came from Karachi and stayed with me for over a few weeks while observing cases as we do them at the University of Toledo Hospital. Simultaneously, on our trips to Pakistan, we were performing complex brain aneurysm cases and showing the interventional radiology fellows, as well as the attendings, as to how we are using flow diversions and stent-assisted intrasaccular device treatments. Simultaneously, we had visiting professors from US go to Karachi, share their ideas and thoughts, and also participate in patient care. One of the limitations that we realized while we were attempting to set up a stroke program in Karachi is lack of advanced neuroimaging. For this purpose, we were able to contract with the Rapid AI, and NICVD became one of the first centers in South Asia, really, to have this advanced imaging technology. We have focused a lot on public service messaging. So last year at the World Stroke Day, my colleague, Dr. Hisham Salahuddin, who actively is practicing in California, working with a local media company, came with this video with a public service message. And in Urdu and Hindi, it goes like, "Jab band ho jaye haath, chehra aur zaban, fauran karo ilaj, bachao apni jaan." It translates roughly as, if your arm or face or your tongue stop working, get rescue or get care immediately and save your life. This was disseminated aggressively on social media platforms, and this is the work that we are currently involved in as well. With regards to our second goal, in terms of contributing positively to the neurointerventional field, we were reached by a startup company from US, the Gravity Medical Technology, who came up with a newer and somewhat lower cost devices for stroke intervention that includes a stent retriever as well as an aspiration catheter. NICVD became the first center in the world to use this technology as first in men study. Similarly, Galaxy Therapeutic, which have a intrasaccular aneurysm treatment device, they tested their device both in Colombia as well as in Pakistan. And currently, based on the results from these two countries, they got approval for a US FDA trial, which is currently ongoing. This is the example from this Galaxy Seal trial. On the left side of the screen, you see this ACA, a one-segment aneurysm, which post-treatment on day number 1 is completely occluded. So given all the efforts that we have put in, what is the status of stroke care in Karachi? So in terms of public sector hospitals, NICVD Karachi is the only center that provides 24/7 acute stroke care. Since then, we have trained experts in other smaller cities in Pakistan as well. This is the current list of larger hospitals in Karachi. There are quite a few. But in green, the NICVD is the only one that's administering TPA and offering mechanical thrombectomy 24/7. There are some private sector hospitals which are providing the similar care as well. As I mentioned, stroke thrombectomy has since been expanded to an inner city in a hospital in Sakhar. This was a recent case performed in Sakhar, which is again a mid-sized city in the province of Sindh. This patient had a right ICA terminus occlusion and post-thrombectomy recanalized completely. Next day, he was able to walk out of the hospital, actually. So far, our Karachi Stroke Initiative has been able to perform, these 4 tasks. That is, laid foundation for the first stroke center in Karachi, working obviously in close conjunction with our partners at the NICVD. We have introduced advanced stroke aneurysm treatments that include the intrasaccular devices and flow diversion devices. We acquired advanced imaging software for stroke detection. As mentioned, we brought in first in men trials for endovascular treatments in Pakistan. But our next few goals is to expand further into other cities in Pakistan. Obviously, our devices are very expensive, and we are working actively with the Sindh government to come up with a process for sustainable funding and supply of these devices. And then another major goal is currently in the public sector hospital, at least in Karachi, there is no biplane suite available. We are actively working with the government as well as fundraising locally to procure this and help the system there. Thank you so much.